Today's featured speaker is Bentley University Associate Professor Rob DeLeo. Rob is a member of our Global Studies Department whose research focuses on preparedness policymaking. His most recent book, Anticipatory Policymaking, When Government Acts to Prevent Problems and Why It Is So Difficult, examines the dynamics of policy change in anticipation of emergent hazards, like novel diseases and other types of slow onset events. Without further ado, please join me in virtually welcoming Professor Rob DeLeo. Thank you, Rob.
Thank you, Emily, for having me here today. And thanks to everyone that logged on to today's webinar. I am really excited to chat with all of you about COVID-19 and more specifically, the political and policymaking response to this particular pandemic. So I think it's pretty safe to say that the coronavirus pandemic, the COVID-19 pandemic, is a historic public health event. It's sickened hundreds of thousands of people, killed thousands more. It has resulted in a virtual shutdown of the economy. It has disrupted almost every aspect of our daily lives, as evidenced by the fact that we're having this webinar today. And while I think it's probably too soon to fully assess what went right versus what went wrong from a political or a policy-making perspective, one thing that's abundantly clear is that we here in the United States, and quite frankly in a number of other countries as well, we're almost totally unprepared for this particular disease. As of February 9th, there were really only a handful of members of the United States Congress who had so much as commented on the outbreak, let alone formulated any sort of preparedness legislation, despite the fact that the CDC, the Centers for Disease Control and Prevention, had already called the outbreak in China an unprecedented global event. Also, as of February, the President of the United States said that he thought that the concern regarding COVID-19 was overblown. He indicated that the WHO's, the World Health Organization's fatality rate was wrong and that the virus would miraculously go away in the spring. We had little to no coordinated federal response in this country for a number of weeks. As of last week, the Centers for Disease Control and Prevention were still really struggling to roll out any sort of mass scale testing protocol, leaving communities, hospitals, states unable to accurately assess the risk associated with this particular virus. So I think it's safe to say that we really squandered some critical time at the beginning of this outbreak, time that would have allowed us to better prepare to manage this disease. And I think that we're still seeing the ripple effects of that squandered time now, even as we're really in full sort of emergency relief pandemic response phase of the outbreak. So what went wrong? Why did we fumble so badly so early in this outbreak? And of course, I think that there's a lot of criticism to go around. The current presidential administration made a number of grave errors at the beginning of the outbreak. One of those errors, I believe, was conflating the virus with the economy. The president, quite frankly, seemed more obsessed with assuaging investors that the market would be okay than providing the general public, governors, mayors, with valuable information about the size and scope of the outbreak in this country at the beginning of the outbreak here in the United States. Ultimately, I think that strategy really sent a wrong message to the public who needed to begin preparing for this disease, and to state and local policymakers who also needed to look at things like, would their hospitals have surge capacity to deal with it? What would they do if they had to require shelter in place? To what extent did they have the materials needed within their states to equip doctors and nurses to safely manage individuals who were sickened with the virus. So that was a grave error. I also think that the president's initial funding request to Congress was woefully insufficient. So if you recall, in February, the president requested about $1.3 billion to help start our preparedness efforts in the United States. In hindsight, we probably needed something in the order of $8 to $10 billion at that stage. And by making that initial request and forcing the Democrats to come back with what, for lack of a better term, was sort of like a funding counteroffer, we again slowed down that preparedness process. But I think there's actually a bigger issue here that this particular outbreak reveals, and it's an issue that transcends just the Trump presidency and perhaps the president's mishandling of it. And that issue is, we here in the United States weren't ready for this epidemic because, quite frankly, we have never made sound investments in preparedness policymaking. If you were to look across time at federal emergency management expenditures and expenditures in the public health and healthcare domains, what you would find is, more often than not, they tend to emphasize response activities as opposed to prevention and preparedness. So one study shows that between the mid-1980s to about 2010, the US government spent close to $82 billion on disaster relief, but we only spent about $7.5 billion on disaster preparedness. In 2013, another study revealed that close to 95% of all global disaster-related expenditures were allocated for disaster relief and response projects, while a mere 5% went towards things like risk reduction and preparedness. And if we look within the healthcare system, in the healthcare sector specifically, what we would find is about 97% of our expenditures go to treating diseases, responding to issues that have already occurred, and only about 3% go to preventative medicine. So we have a curious arrangement in the United States, and indeed in many industrialized democracies, where for decades we haven't been investing in preparedness and prevention. And so when a disease like COVID-19 strikes, we're really caught flat-footed. And there's a larger sort of paradox to our underinvestment in preparedness, and that is preparedness at the end of the day, although it's not the most politically exciting thing for policymakers to do, it has really an excellent ROI. So it's estimated that every $1 spent on preparedness results in about $7 in immediate savings to overall emergency management programs, and nearly $15 in future savings to emergency management programs, let alone the countless lives that can be saved by adequately readying ourselves for things like novel diseases, as well as hurricanes, tornadoes, and other types of hazards. So we don't do a good job preparing in this country. And the question that I want to address in today is why? How did we get to this place? Why is it that we find ourselves chronically underprepared for things? And then what possibly can we do about it? And in addressing the last point, I'm going to derive some of my information from a recent study I've done with colleagues at the University of California, Santa Barbara. So if we were to look at the emergency management literature on preparedness, what we would find is there's really three primary reasons why government and why policymakers fail to prepare. And those reasons are psychological, they're institutional, and then finally, and perhaps most importantly to my own research, they're political. So on a psychological level, on an individual level, humans, us, are really not particularly well equipped to prepare. we are actually conditioned to learn through trial and error. So we have a negative experience in our own lives. Hopefully we learn from that negative experience, and then we make changes to avoid that negative experience in the future. And that can work very well in a lot of instances. So for example, students in my class may not do particularly well on my first quiz or my midterm exam, but more often than not, a sizable percentage of those students will learn from that experience, revisit the mistakes they made on the quiz or the midterm, and they will improve on the final exam. It doesn't mean that my lecture materials delivered any differently or that the types of questions I ask are any different. It's only that they learned through trial and error, and they learned how it is that I go about structuring my tests. The problem with events like COVID-19, and indeed all disasters, is that they are typically characterized as low probability, high consequence events, meaning for many of us, we don't have, thankfully, the opportunity to experience them, which means that that trial and error learning process doesn't really work particularly well when it comes to disaster preparedness. So until we've personally experienced something, or until policymakers are in office while some sort of disaster happens, it's unlikely that they'll learn from that disaster and begin to make investments in preparedness. The second barrier to preparedness in this country is institutional. And when I use the term institutions, I'm referring to the way in which our government is organized, the structure of our system of government. And paradoxically, federalism in the emergency management domain is really somewhat of a gift and a curse. On the one hand, federalism, which refers to the constitutional division of powers between state governments and the national governments, on the one hand, it allows us to respond quickly to disasters, in part because states are very close to the people, and they have a better sense of the unique cultural, economic, and political dynamics within their electorate. But on the other hand, it makes it very difficult for us to come up with any sort of unified preparedness program, in part because the Constitution devolves most emergency management responsibilities down to the states. So it goes without saying that there is tremendous inequality across states. There's also dramatic differences in terms of the degree of professionalism at the state level, meaning some states have larger, more robust bureaucracies than other states. And so some states are simply going to be better positioned to prepare and invest in preparedness than other states, just like they'll be better positioned to respond. And what we find is, in the outbreak of something like COVID-19, having this sort of decentralized system or having these decentralized preparedness infrastructures really doesn't suit us well, because emerging diseases don't respect borders. They don't know the difference between Massachusetts and New York and sort of stop at state lines. And so it really takes a unified federal response to reach an adequate level of preparedness. And that simply doesn't happen in a federal system that devolves so much power to the states. But I actually think that the most important reason, or the most significant barrier to public health preparedness, is a political one. And conventional wisdom tells us, and most policymakers actually believe, that voters don't reward preparedness. Therefore, they have little incentive to support laws and bills and policies that invest in preparedness. So the literature on voting behavior tells us that voters tend to keep a running tally of what incumbents do while they're in office. And usually when they decide how to vote, or whether they want to vote to re-elect an existing office holders, they're going to look at the extent to which that office holder did things in the previous session that improved their lives. So was the economy good in the previous session? Did this particular office holder provide them with a tax break? Maybe they were able to secure funding for a project in their district. Well, when it comes to disaster preparedness, elected officials believe that because these projects are so intangible, voters won't reward them for it. So why would they make investments? Moreover, studies suggest that voters actually reward incumbent politicians for investing in things like disaster relief. So ironically, even though preparedness can save lives, despite the fact that we're typically unprepared, we still reward elected officials for relieving a disaster. So a disaster declaration, for example, can result in something like a vote share of upwards of 20 times greater than the amount that may have been lost by disaster. So whereas elected officials don't get rewarded for preparedness, they do get rewarded for disaster relief. So it's really no surprise then that we have this sort of perfect storm that comes about when there's an outbreak of a novel disease, because politically, institutionally, and psychologically, we're really ill-equipped to prepare for things. So in closing, what can we do about this? If we don't like the situation we're in now, if we don't want to see something like this happen again, what is it that we as voters, we as individuals can do to make sure that, God forbid, there's another instance of a novel disease pandemic, we're better positioned to prepare for it? So I want to start by saying that when it comes to COVID-19, more or less, I think the horse has left the proverbial barn. There's little we can do to prepare at this point because we are really in full disaster relief mode. To that degree, I would be remiss if I didn't note that on an individual level, I know that there's a lot of talk about social distancing, and I think that that's important, but I would argue that we should be actually practicing physical distancing, not social distancing at this point in time. So research suggests that during disaster, life and death often comes down to a community's degree of social capital or its level of connectedness, not necessarily the response of state or national or local governments. So for example, if you were to look at the 1995 Chicago heat waves, what you would find is that it wasn't really things like age or race or demographics that perfectly predicted how vulnerable someone was or whether or not they would die during that disaster. It was actually social isolation. So people who are more socially isolated during disasters are less likely to be able to weather that particular disaster. So this is sort of a call to you. If you have any elderly neighbors, or if you have any neighbors that are living on their own, or family and friends that maybe don't live with someone else, check in with them. Make sure they're not socially isolated, even if we only can do that remotely. I think that that will be very important. Now, what can we do going forward? What can we do to further incentivize policymakers and public officials to make the kinds of investments in preparedness and prevention that we're going to need, not only to weather things like COVID-19 and other novel disease outbreaks, but the myriad of other emerging hazards associated with climate change and the spread of other novel diseases. And I think that there's three things that we can do and that I hope you take away from this. First of all, as noted before, elected officials don't invest in preparedness because they don't think you, the voters, care about preparedness. There is a belief that if they support the types of policies and programs that will invest in things like disease prevention or climate resilience, that they won't be rewarded for it at the polls. Now, I actually believe that in some respects, that's a false assumption. My colleagues and I recently circulated a nationwide survey of voters, and what we found was actually quite interesting. Although emergency management certainly ranks far lower than things like healthcare, the economy, even education policy in the minds of voters, when you ask voters if they would want to see government invest in relief and preparedness, typically they suggest that they would want spending in both areas, that they see the value in investing in things that have such a high ROI. So to that end, I think it's very important that we as voters signal to our elected officials that we want them to do these types of things, that we want them to invest in preparedness. Relatedly, I also think it's important that policy advocates, scientists, people who are working in different fields that are affected by these types of disasters, which within the context of COVID-19 is really all of us. I think it's important that we look for creative ways to make prevention and preparedness salient at a district level. So there's a lot of research out there on this concept of pork barrel spending, or spending projects that are very visible, that policymakers can credit claim for, or that they can put on their brochure in the run-up to the next election. Well, that can be challenging in the context of preparedness, but what we're finding is, particularly in the natural disasters domain, is that there's a lot of interesting projects that at first glance may not look like preparedness, but can go a long way towards making us safer. So for example, in the southeast coast of Massachusetts, there are a lot of communities that are investing in things like wetland restoration projects, or even revitalizing abandoned cranberry bogs as a way to help prevent flooding from climate related storms and sea level rise. These projects can be great public spaces. They can also be things that if policymakers are able to secure funding for, they can easily credit claim for, and voters will reward. And then one final point, and I think this is particularly important within the context of COVID-19, how we talk about disaster preparedness, or how we talk about disasters in general, can go a long way towards shaping policy behavior. That same survey that I mentioned before also asked people to think about whether disasters will hurt them in the future, or to think about the effects of disasters in the past. And one of our key findings was the best way to get policymakers and voters to think about the future is to actually describe losses from the past. So our data suggests that elected officials are much more likely to invest in preparedness programs when they are reminded about losses resulting from past or previous disasters, as opposed to potential or hypothetical losses that may or may not occur 5, 10, 15 years in the future. So as we think about the COVID-19 pandemic, it will be important for us to remind policymakers of just how damaging this pandemic was, because as hard as it is for us to believe, we will eventually move past this. And it's probable that policymakers will shift their attention to other concerns. So as we advocate for future investments in public health preparedness, we need to use this as a watershed event to remind policymakers of the dangers of not acting on a particular issue. So that's all I have for now. I am happy to field any questions that you all may have. And thank you for being what I assume was a very attentive audience.
Thanks, Rob. All right, we have lots of good questions. So we'll start with some that have been previously provided to us from our audience. Let's see. Okay, first question from Denise Riker, MBA 90. Does the federal government need a department dedicated to pandemics, and why don't we have one?
Oh, that's a great question. So technically speaking, we do have a department dedicated to pandemics, and I should say we have an agency dedicated to pandemics, and that's the Centers for Disease Control and Prevention. So if you were to look at the CDC mission, it's charged with addressing both non-communicable diseases, so things like obesity, smoking-related cancers, heart disease. But an important part of its charge is also for preparing the nation for potential outbreaks of novel or communicable diseases. So things like pandemic influenza, SARS, and other emerging diseases. Now, to the question, the alumni's question, it gets a little murky when we talk about actually managing the outbreak. So really, a lot of that responsibility could fall on the shoulders of the Federal Emergency Management Agency, or FEMA, but most day-to-day operations, again, as I noted in my lecture, that's really a responsibility of the states. So the question as to whether or not we should have just a federal agency, I would suggest we also need to have state agencies that have a similar function as the CDC. I would also say it might be important to elevate the role of public health officials within the White House. Have individuals who are working very closely with the president to manage these types of things, even when they're only a possibility as opposed to being a full outbreak as we have now.
Awesome. All right. Well, we've had a lot of questions around whether about the levels of government and the decisions being made at those various levels. And I know you spoke to that to some extent during your talk, but one question from Caroline Eliopoulos is, which level of government, a 2018 grad, which level of government is most constrained and which level is perhaps most important in its response? And sort of a dual question that came from one of our attendees today is really around, do you think certain governors within the US may use this pandemic to take greater control than before, and sort of the role of governors in all of this?
Oh, those are both great questions. But first and foremost, I would be remiss if I didn't say hello to Caroline. She was actually one of my advisees, a public policy grad. And she was, without question, one of my favorite students of all time. So hello, Caroline, if you're out there. Those are both really, really good questions. And as far as which level is most important and most constrained, I think that to some degree, it depends on what stage in the pandemic or emergency response we're in. So when it comes to public health preparedness, when it comes to the early stages of an outbreak, a lot of that responsibility really falls on the shoulders of the Center for Disease Control and Prevention and other global public health actors. So as far as tracking diseases, as far as tabulating cases, beginning to develop models that can help us predict the spread of a disease, that is really a chief responsibility of the CDC. Now, once it's on our shores, as I've noted before, and once we have a large accumulation of cases at a national level, a lot of that responsibility shifts to the states. So constitutionally, states really retain most of the authority to guide our emergency response. So we can see that it's really up to states to dictate things like school closures, shutting down of restaurants, quarantining individuals. That really comes down to the states. And Caroline's question is a very pertinent one, because states are also really cash-strapped. Just as we delegate a lot of responsibility to them, they also operate in a financial environment where where they have to balance their budget. They can't run the types of deficits that the federal government can. So it's challenging for them to manage these things, in part because they don't necessarily have the resources that the federal government has. So I think we're seeing that play out now. There was a follow-up question about governors, Emily. Can you, do you mind repeating that?
Yes, that's from an anonymous attendee. So the question is, in addition to that, do you think certain governors within the US may attempt to take greater control than before? Also wondering about whether shelter in place is a legal option for our governors.
Yeah. As far as the authority of governors to quarantine people and sort of take more control, what has been very striking to me in watching the response of governors, including Charlie Baker here in Massachusetts and Governor Cuomo in New York, who's obviously facing an incredibly challenging situation, is just how measured, for the most part, they have been in their response. So if you were to look at Governor Cuomo, he understood that decisions, even that may seem even as straightforward as closing a school, really can have profound social effects that may not be all that obvious at first glance. So where will students get their food? What are we going to do about childcare? What about childcare for the individuals that are on the front lines of this pandemic, like nurses and doctors, or the police who can't necessarily stay home from work? So as far as governors having this sort of power grab during the pandemic, I haven't noticed that at all. And I found that they've been very measured, very reasonable in their response. Now, of course, there's going to be criticism about whether or not they were too late in some instances, whether they waited too long. But, quite frankly, at all levels of government, I think that both the federal and the state level, policymakers have been pretty reluctant to overly constrain individual civil liberties through things like quarantine and required stay-in-place measures.
Great. Well, as you know, we have a global audience in our alumni, family, and friends. So this question comes from Palin, an MSA 13, MSMA 15 grad. How do you view the effectiveness and other impact of the different policies imposed by Chinese and the US government?
Oh, that's a really good question. And, I think when the dust settles on this pandemic, the Chinese case for a number of reasons is one that public health officials are going to study really, really closely. So let me begin by saying that what the Chinese government did was unprecedented by any standard from a public health perspective. So, the Chinese government more or less confined 760 million people to their homes for a number of weeks. And the numbers that came out today suggest that this worked, right? I mean, they don't have any new reported cases in China right now. And if you were to tell me a week ago that would be the case, I would say you're crazy. Now, we obviously need to proceed with caution. Novel disease outbreaks tend to rebound. And so, they're slowly reacclimating to normalcy in China. But that was a smashing success. There was probably, however, one glaring flaw in China's response. And I actually fear that this was also a glaring flaw in the United States response. And that was, they probably started a little too late. In the initial weeks of the outbreak in December and January, Wuhan authorities were really slow to report cases of this mysterious infection. And, that delay at the beginning of the outbreak really undermined the Chinese government as well as international authorities' ability to get ahead of this disease. So much of what we do in public health relies on disease surveillance. And that's because in a perfect world, we can get ahead of these diseases, isolate populations that are most at risk, and hopefully avoid some of these really sort of stringent restraints on civil liberties. So on the one hand, I think China certainly got its act together and has clearly gotten control of this disease. But on the other hand, I think China, as well as the United States, was way too lackadaisical at the beginning of this outbreak.
All right, thank you. Let's see, we've got some other questions, and I haven't pre-screened these with you, Rob, so
okay.
Let's see if we had a question from Mikal. How should governments help businesses survive the pandemic? Should they even try to help? Paired with another question from Amanda Gerby, how many corporations or startups have this plan in place? So perhaps you could talk a little bit about how businesses, industries, especially small businesses and those industries that this is really having the most impact on are being affected, and how perhaps policy could have been written on their side.
So excellent question. And my partner's a small business owner, so I'm getting a good sense of how damaging this has been, watching her experience with all this. So I empathize with small businesses. So let me start with the first question. So how should government provide help? The first thing we need to do to get our economy back on track is get our lives back to normalcy. We need to get control of this disease. So I think a useful sort of metaphor for this is like, at this stage, it's like ripping off a Band-Aid. I know social distancing is difficult. I know staying in our homes is difficult. It pains me that I'm not going to get to see my students next week, but this is where we are. So the best thing we can do for all businesses in the economy is get the number of cases under control in this country. Because until we have people able to go back to work, we can provide all the relief we want. It's still not going to be enough. I think that some of the policy responses that are aiming to inject money back into the economy are sound. I think they're a great idea. Giving Americans checks that they can spend so they can spend money, I think is a great idea. I think providing financial relief to small businesses is also a great idea. I think all of that can help, but it's most important that we get ahead of this. The question about how many companies are actually were prepared for this is a fascinating one. And, I don't know the answer to that question, although I can tell you that I'm trying to get to the bottom of it. So students in my honors seminar class are actually partnering with the Greater Boston Chamber of Commerce this semester to look at emergency preparedness among businesses in the Greater Boston area. We're still waiting for our survey results to come back. But really, we don't have a good sense of how many organizations are preparing for any types of disasters, let alone something as potentially catastrophic as this outbreak was. My gut tells me that there's probably a lot of large corporations that are beginning to do work with respect to sustainability. So in thinking about ways in which maybe they can make themselves more resilient to things like climate change, and thinking about ways in which they can make themselves more energy efficient. And from a preparedness perspective, all of that will certainly help. But as far as having, real plans in place for employees to work offline en masse, I find it hard to believe that many of them have anything that approaches the level of preparedness that would have been needed to manage something like this.
Yeah, it certainly is going to be a topic of conversation for days, weeks, years to come.
Indeed.
We have so many good questions here.
Awesome.
I will say with about 15 minutes left, perhaps we take two more.
Cool.
One of the questions, again, sort of thinking globally, from Sylvia Martinez, MBA 2017. How influenced do you think are Latin American politicians by the decisions taken by the politicians in the US and others that have really addressed this issue?
Oh, that is a great question. So the Latin American case is a really interesting one, in part because, the numbers of COVID-19 in Latin America, they haven't really reached the levels we've seen in Europe yet. But actually, Latin American leaders have been super aggressive in managing the outbreak of the disease within their borders. So Venezuela's President Maduro recently announced that the whole country would be under quarantine. I believe that quarantine started on Tuesday. Peru has already declared a national emergency, closing its borders. Chile indicated that it planned to close its borders. So, in many respects, I think that Latin America appears to have done a pretty good job deriving lessons from the states around it and acting accordingly. Now, of course, hindsight is 2020, and if you have a smaller number of cases and it's taking the disease a longer time to spread within your borders, then obviously that gives you an advantage. But so far, Latin America has, I think, definitely taken cues from North America as well as Europe in terms of controlling population flows as a way to control the outbreak.
All right, we're going to ask one final question here and end on hopefully somewhat of a positive note with everything that's going on. This is from attendee Julia LeBlanc. She wants to know, is there a silver lining here? What do you think about the relief that the president has declared, such as military ships as operating rooms sent to New York and the West Coast? Are efforts such as these sufficient? And, is there really a positive light we can shed on this?
I think that there's a few positive lights, and I would actually, I think that definitely the federal government appears to have sort of awakened to this crisis and is allocating resources appropriately, and I think that will continue. But one of the things I really haven't talked about is the role of individuals during a disaster, and there's this pervasive myth. And to some degree, I think, the media and movies perpetuate it, that when disaster happens, we all become really self-involved and there's looting and crime and we devolve into this state of nature. But, none of that has ever been really borne out with empirical research. And I think what we're finding is even as we're socially distant from one another, there are clusters and communities of people that want to help one another out. So I know on my own sort of social media world, I have a lot of friends who are paying it forward to their local barber, maybe buying stuff from small businesses that can be delivered, who are donating masks or gloves that they may have stockpiled for themselves to local hospitals. So I think the silver lining here is, as Americans, as humans, in times of crisis, we usually do come together and want to help each other out. And I think that even this sort of little webinar community we have pays testament to that. And so it really makes me feel confident that as difficult as it is, I think we as Americans, even in these incredibly polarized times, we'll come out better for it and we'll learn from it. I would also hope that the other silver lining is that we learn from our mistakes in this case, because as I alluded to, in my presentation, novel diseases are only one of a number of emerging hazards that we're going to have to contend with, that my nieces are going to have to contend with, that your children are going to have to contend with. And I think that this really highlights the fact that preparedness is a muscle. You can't just expect it to work when disaster happens. You need to constantly replenish it and be prepared for something, even if that something might not happen for 10 or 15 years down the line. So it's my hope that this is a watershed moment for preparedness globally and domestically, and that as these emerging hazards reemerge in the future, your kids, my nieces, our families will be better positioned to weather those storms going forward.
Well, that's a great point to end on, I think. And thank you so much for being with us today and preparing your talk and being our first virtual event for our Bentley community. Thank you to everyone who joined us today. Thank you, Rob. Thank you to our community. And we hope you'll stick with us through the rest of these webinars as we continue to launch virtual events for each and every one of you. Thanks again and have a great day.
Thank you for having me. Have a great day, everyone.